In this video, we're going to describe how to perform the manual muscle test for knee flexion, which is testing the hamstrings muscle group. So semimembranosus, semitendinosus, and biceps femoris. First test is going to be testing all of those muscles, and then we'll show you a couple of breakout tests to try to bias the medial hamstring group, medial hamstring, we still have two of them, or the lateral hamstring, biceps femoris. So first, the combined test we're going to perform in the mid-range of knee flexion. So let's just say we've gone through and I've seen active range on his unaffected side, I've seen him perform active range on his affected side, and I've also palpated the muscle group while he's performing that active range. For hamstrings, you can either palpate the muscle belly or you can palpate the tendons right just proximal to the knee. So for this test, we're going to place him in the mid-range of knee flexion, and what that's described as in the book is about 45 degrees of knee flexion. So if you think about 90 degrees just being straight up and down, I'm going to cut that in half, and that's going to be approximately 45 degrees. So in this position, he's already shown me he's able to move there. I'm going to apply resistance in a downward direction. I'm not going to push on the hamstrings muscle group because again, we're testing that muscle group. If my arms are long enough, I can kind of stabilize at the iliac crest or at the pelvis. So I'm going to say, Eric, can you hold strong and don't let me straighten out your leg? Hold, 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 hold. Good. So if he is able to resist maximal resistance, I'd grade that a 5. Moderate resistance, I'd grade it a 4. If he's able to just go through the range of motion but tolerate no resistance, that would be a 3. For a 2 to 1, I'm going to change positions, but I am going to show you the breakout test before we have him in a sideline position for a 2. The other thing I want to mention with the hamstrings muscle group is it's common that sometimes people will get muscle cramps if you pull too hard or too quickly. So with this test, it is particularly important to have a gradual buildup of force so as not to cramp out your patient and have significant amount of discomfort. So if you noticed, I kind of eased into my resistance and I eased off of my resistance. Okay, so now that I've said that, the breakout tests for the different hamstrings are going to be as such. So I'm still going to place him in approximately 45 degrees of knee flexion. In order to bias the medial hamstrings, I'm going to turn his tibia into internal rotation. What that will also look like is his toes are going to point towards the muscle group that I'm biasing. Now I'm going to pull him into knee extension, but I'm also going to pull a little bit at an oblique angle away from the semimembranosus and semitendinosus that I'm testing, the medial hamstrings. So Eric, can you hold there? So I've pre-positioned him, and I'm going to pull down and away. So hold strong, hold, 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 hold. Good. And the grading is the same. So 5, maximal resistance, 4, moderate resistance, 3, he's able to attain that position. 2 or a 1 are not as specific to these bias tests, but we'll show you the sideline grade 2 for the combined hamstrings. If I want to bias the biceps femoris lateral hamstring, I can bring him into 45 degrees of flexion again, but I'm going to externally rotate his tibia, and notice his toe points out away towards that muscle group, and I'm going to pull down but also away this way. All right, so hold nice and strong there, Eric. Hold, 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 hold. Okay, good. So those are the 2 breakout tests. Next, I'm going to have you lie on your left side for me. So if he's unable to, again, attain a grade of 5, 4, 3, I'm going to cradle the leg and support it, and I'm going to ask him to just bend his knee and try to kick his butt. Good. So if he's able to move through that full range of motion, that would be a grade of 2 while I'm supporting the weight of the leg.